I wanted to share some experiences of my own on stepping on the cosmetic surgery ladder. Choose your doctor wisely and choose somebody that you feel comfortable with. And always remember that just because somebody is on the telly and charges a lot of money does not mean they are the best for you. From the time I'd made my mind up to do something about my appearance, from that time to the time I actually did something about it was actually over 2 years. And every individual person will have their own reasons for going down the surgery route. In my own case, it was because I'd spent 25 years at home looking after children, one of whom was severely handicapped, and I didn't do anything for myself. I didn't care what I looked like particularly. I never wore makeup and basically did not take any care of myself at all. I put on a lot of weight. And then 4 years ago, my handicapped child died, and I found myself back at work and working in a very glamorous environment and beginning to feel like the old maiden aunt. I was rather depressed when I looked at my reflection, and therefore I wanted to do something about it. When I first saw Mr. Vadodaria, he simply asked me what I was unhappy about, and he gave me very realistic expectations about the results that I might achieve. He would not perform any surgery on me until I'd reduced my blood pressure and lost some weight. So both these issues were addressed, and I should have done it a lot sooner, but this was the catalyst I needed to do that. I had my procedure 12 weeks ago. I'm delighted with the results. I could not have had better care or a happier 24 hours, if you can say that, in the hospital. I'm 60 next year, and I would quite like one other little tweak before I reach that goal. And as I've breastfed 3 children, I think everybody can guess what that little tweak might be. I would have no hesitation in coming back to Mr. Vadodaria, and I truly recommend anybody that's thinking about having an enhancement, make him your first and last port of call.
Jacqueline, what procedure you underwent?
Oh, lower facelift.
Mm-hmm. And anything else was done?
Oh, the sorry. I had all the excess skin taken away from my top lid, which were very wrinkled and very heavy. And Mr. Vadodaria did that first, and that healed up nicely. And then we took away my nice sausage roll of fat under my chin and just lifted it a little bit. The best thing is that nobody has guessed that I've had a facelift, although I haven't denied it to anybody because I think that's silly. But everybody has said to me, what have you done? You just look a lot healthier, you look a lot better, you look younger. But they have not guessed that. And Mr. Vadodaria and I did discuss this, and I did say I didn't want to look as if I'd been caught in a wind tunnel or like Joan Rivers. I just wanted it to look natural, but just a bit better. Me, but a bit better, not an alien being.
Okay, that's good. And Jacqueline, are you happy for this 4 minutes of video clip art to be on a public domain?
I think a lot of women are going, it's a very big decision to make. Not only just a financial decision, it's a decision about having an anaesthetic and having an invasive procedure. And you've got to be very sure about who you're going to and be confident. And I was very scared about doing this, but now, not at all.
Yeah. In what way do you think that listening to this, video for possibly 5 minutes will help people to decide? In what way it will help?
Well, I'm hoping that people will see that I'm just an ordinary woman. I'm not anything special. I'm not on the telly. I did this purely for myself. I'm happily married. I've been married for 30 years. I don't need to look young for any reason. I just wanted to feel a little bit better about myself. And in the past, I'd always said that I was the sort of person that would grow old gracefully and never interfere with nature, which is something you say when you're 20 or 30 or 40. But when you get closer to 60 and you start feeling a bit unhappy about the way you look, nowadays it's so easy to find somebody and have a procedure done. You needn't be afraid of it.
That's good. Thank you. That's good. Very nice. Very succinct.